Hi, I'm Dr. Rashmi Yogish, Clinical Director and Consultant, Khushi Fertility and IVF Center, JP Nagar, Bangalore. Folic acid or vitamin B9 is a very important prenatal vitamin that has to be started orally at least 3 months before one decides to get pregnant. The reason behind this is proper concentration of the folic acid would increase the chances of pregnancy and will also make sure the neural development of the fetus occurs normally, and the chances of having neural tube defects like spina bifida will come down drastically if the folic acid is taken during the phase of organogenesis or during the phase that the baby's organs are being formed. Therefore, one should start taking these prenatal vitamins with folic acid at least 1 month before one decides to stop using contraception, and ideally 3 months before one starts planning for pregnancy. The folic acid is actually in 4 different generations available to us. The first generation is folate, which is available in food. There are a lot of foods that are rich in the folic acid or the folates. These are broccoli, spinach, asparagus, peas, chickpeas, and also some fortified food cereals. One should ensure that these are included in the diet when planning for pregnancy. The next one is the second generation folic acid. This comes in the form of folic acid tablet, 5 milligrams, and it's usually the round yellow color tablet one pops in before trying to get pregnant. So this is the second generation folic acid. The third generation folic acid, the one which is now very much in vogue, is the L-methylfolate 1 milligram tablet. And the reason why the L-methylfolate is being advocated all over is because a lot of women, especially women in India, do have deficiency of an enzyme called as MTHFR reductase. Whenever the folic acid is taken orally in the body, the folic acid is converted to something called as dihydrofolate, quadrihydrofolate, or the tetrahydrofolate, and then it gets converted into the 5-methyl tetrahydrofluorate, which is also called as L-methylfolate. The L-methylfolate is a one which has to be absorbed by the body. So until and unless the folic acid gets converted into the L-methylfolate, it cannot be used by our body. And some women have deficiency in the converting enzyme, and that's the reason why this folic acid doesn't work on them, and they end up having abortions, or they sometimes have abnormal fetuses. Therefore, it's very important that it's better and advisable to take the L-methylfolate rather than take a chance with the 5 milligram folic acid tablet. And nowadays, there is another folic acid, the 4th generation folic acid tablet that's available, that's called as the quadrifolate. The advantage of this quadrifolate is that this quadrifolic acid tablet gets converted to the 5-methyl tetrahydrofolate or the L-methylfolate directly, because it's like a structural analog of this tablet. So it doesn't need any enzyme for conversion. And the advantage of this quadrifolate tablet is that it doesn't get absorbed in the stomach, it gets absorbed directly in the intestine, and therefore the availability of the folic acid is maximum with this. Apart from that, this has got the maximum water solubility. Therefore, this ensures that the folic acid, whatever is taken, is utilized to the fullest. The other important information everyone should know about the folic acid when you decide about the kind of folic acid you actually start off with is that it is advisable to take the L-methylfolate and the quadrifolate over the folic acid 5 milligram tablet, because sometimes when there is deficiency of the converting enzyme, most of the folic acid that is taken orally remains as an unmetabolized folic acid in the system, which is called as UMFA. The disadvantage of this unmetabolized or the unmethylated folic acid is that this can be another reason for increasing the risk of miscarriage, and therefore it's important that when you go to the medical shop or the pharmacy to buy a folic acid tablet, ensure that you buy something which has got L-methylfolate or the quadrifolate instead of buying the 5 milligram folic acid tablet. if you want to be a little more safer.